This is an important question that we've been asked quite a lot lately in terms of if someone can be reinfected with COVID-19. So what we understand, this is an area of active research by scientists all over the world, clinicians all over the world. What we understand from people who are infected with the SARS-CoV-2 virus, the virus that causes COVID-19, is that they will develop an immune response. They will develop antibodies, neutralizing antibodies, and an immune response that will provide some protection against reinfection. What we don't know right now is how strong that protection is and for how long that protection will last. And we need answers to those questions to be able to determine if someone can be reinfected after that immunity wears off. So this is an area of active research for the specific SARS-CoV-2 virus. We do have some answers for other coronaviruses, the MERS coronavirus and the SARS-CoV-1 coronavirus, which emerged in 2003, indicating that people have an immunity that lasts over 12 months or so and maybe even longer. And we have some results from the human coronaviruses, the common cold coronaviruses that circulate the globe regularly, and your protection lasts a lot shorter than that. So we don't have a complete answer, but it is an area of active research, and I should say an active collaborative research all over the world.
Thank you very much, Dr. Van Kerkhoff and Dr. Ryan. Now we have a question from Bianca from Globo in Brazil. Bianca, please go ahead. Unmute yourself and please go ahead.
Hi, Margaret. Can you hear me?
Very well, Bianca. Please go ahead.
Many thanks for your attention, for taking my question. Journalist from Globo News and Globo TV, Brazil. I know that Brazil is between the 63 countries that Mark Lowcock mentioned, where people need humanitarian assistance. So I would like to hear from Mark, how concerned are you, Mark, with the situation there in Brazil? And from Dr. Tedros or Dr. Ryan, if they can give us an updated general view of the challenge Brazil is facing now with more than 2 million cases. Thanks a lot.
Okay, this one's for Mr. Lowcock, so we'll go to Mr. Lowcock first, and then we've got some things to say in the room too.
Well, thank you very much. The main activity of the humanitarian agencies, which I coordinate in Brazil, relates to support for Brazil in the way they are helping people who've left Venezuela. And Brazil, like Colombia, Peru, Ecuador, a range of other countries, is taking a large burden of helping support millions of Venezuelans who, for reasons everyone's familiar with, have in recent years left their country. Now, it's probably important for me also to say that we recognize that Brazil itself has a very substantial problem, and I know that Tedros and Mike will talk about WHO's perspective on that and the support and so on, but what the humanitarian agencies do is focus their effort on the very poorest countries. So Brazil, country obviously which has developed a lot over recent decades, has typically not needed assistance from humanitarian agencies in the way, say, some African countries or some countries caught up in conflict have done. So we do not at the moment, and we hope we never need to have a strong engagement of the humanitarian agencies in dealing with the crisis in Brazil, because Brazil has built up a lot of capability of its own through the process of development. So I think that's probably what I can say on this topic, but I know that Tedros and Mike will have other things to add.
Yeah, I can make some general points. Again, the number of daily cases has stabilized between 40 and about 45,000. So we're not seeing the daily increases that we've seen possibly through the month of April and May. We saw very high rate of increase and coming then into mid-June and into July, we see that plateau occurring. But what's not happening yet is that disease has not turned and is not heading down the mountain. So from that perspective, the numbers have stabilized, but what they haven't done is started to fall in a systematic day-by-day way. So Brazil is still in the middle of this, still very much in the middle of this fight. The last 24 hours, I think over 45,000 cases with 1,322 deaths. Overall, about 11% of cases, more than 1 in 10 cases in Brazil is a healthcare worker, which is in itself a tragedy, and Dr. Tedros referred to that similar situation in Spain. So our health workers are paying the heaviest price. The health system, the reproductive number overall in April and May, the reproductive number was quite high. It was over 1.5 and in many cases over 2. In other words, each case was generating 2 or more other cases. That in general across all of the regions has stabilized now and is somewhere between 0.5 and 1.5 for across the different states. So the virus is not, in a sense, doubling itself in the community as quickly as it was before. So the rise in Brazil is no longer exponential. It has plateaued, but the cases and deaths continue to occur, and there is absolutely no guarantee that that will go down by itself. We've seen this in other countries. There is a plateau. There is an opportunity here now for Brazil to push the disease down, to suppress the transmission of the virus, to take control. Up to now, in many countries, including Brazil, the virus is being in charge. The virus sets the rules. We need to set the rules for the virus. And there is an opportunity once those numbers have stabilized to drive transmission downwards. And I think that opportunity exists now for Brazil to do that. But it is going to take a very sustained, concerted action in order for that to occur. And we wish the authorities in Brazil, we wish the frontline health workers every success in doing that. And WHO and PAHO will be with them every step of the way in doing that.
Thank you very much. The next question comes from Dina Abi Saab, who writes for a number of outlets in the Gulf states. Dina, please go ahead with your question. Dina, can you unmute yourself, please, and ask your question? We can't hear you. Okay, Dina, we'll come back to you, and we'll go to our next person. The next reporter is Catherine from France 24. Please go ahead, Catherine.
Yes, thank you, Margaret, for taking my question. In fact, this is a very precise question regarding some research made apparently in Israel regarding medicine, a powder that could block some of the infection, but through the nose. It is apparently a powder based on intranasal product. It's an intranasal product that could block the droplets to enter through the nose. So do you think that it is an interesting research? Is it efficient? Is it part of the different treatments that you are looking into? Thank you.
I think we need, I'm not personally aware of such a product in Israel, and we'd certainly need a lot more information before we could make any comment. But what have been developed in the past, and there are a number of the nasal pathway, and many of us use nasal products in the winter when people have colds or flus, and we can inhale certain products to relieve symptoms. So there's a difference here between symptom relief and treatment of a case or prevention of a case. And there are lots of products out there that are intranasal that allow people to achieve relief when they have colds and flus. And I'm sure many people are using them during the era of COVID. There are various other therapeutic products that can be delivered through the intranasal route, and I know some companies, for example, I know that the company Gilead is currently trying to develop an intranasal or an inhaled version of its drug. And I know also on the vaccine development front that there are vaccines currently being under development that may also be delivered through the nasal route. So there are potentially promising intranasal solutions. But in a sense, we have to decide if drugs or vaccines are best delivered by oral, by injection, or by inhalation, or by intranasal routes. But certainly I'm not aware of any particular powder or any particular medicine from Israel, and we would need more information before making a specific comment on that. Maria, I don't know if you have any.
Thank you very much, Dr. Ryan. We now have Michael from CNN. Michael, please unmute yourself and go ahead.
Good morning from British Columbia. Can you hear me?
Very well. Welcome to Geneva.
Okay. Thank you for taking my question. Question for Mark, if I can. And Mark, I have to salute the work of Archer and your colleagues. I've watched them work up closely as a UN worker and as a journalist. So you have some of the best in emergencies. My question is the following, and I think it overlaps with an earlier one a bit. But it seems to a lot of us tracking this that conflicts are not only lasting longer, they are more lethal. And I know today, for example, is the 6th anniversary of the downing of MH17 in eastern Ukraine. And that conflict has lasted 6 years, killed more than 14,000, displaced millions. But why is that danger factor, that lethal factor, much, much bigger these days than before? Thank you very much.
Mr. Lecoq, please go ahead. Yes.
Yeah, thank you very much. So you're right in terms of what's happened. I mean, you used the example of eastern Ukraine. The conflict in Syria is nearly 10 years old now, longer than the First and Second World Wars combined. The Yemen conflict is more than 5 years old. Internal conflicts in and around the Lake Chad Basin have been going on for many years. Why is this happening? Well, I think it's largely a commentary on the state of geopolitics, frankly, that the world was much better, more capable 10, 15 years ago in dealing with these kind of problems, both preventing them and then when they did occur, resolving them, than it is in the current era. We see that particularly also in the Libya crisis, where what we've got, as we have with some of the others I've referred to, is not just an issue inside the country. We have multiple external partners taking sides and engaging themselves. And this is the biggest driver of the huge increase we've seen in humanitarian suffering. Most humanitarian suffering these days arises not from earthquakes or typhoons or floods, natural events. It arises from human actions. And the world needs to get better at resolving these problems. Now, of course, as I said earlier, there are underlying drivers, political, economic, environmental. And one of the things that we're also seeing is more conflict-related problems which are driven in an underlying way or made worse in an underlying way by resource pressures. Now, the only way out of this set of challenges is firstly to contain the immediate problem. That's where humanitarian assistance comes in, and the world has a very good humanitarian system which reaches more than 100 million people a year and certainly saves millions of lives a year and prevents some conflicts spreading even further and the global public bads being exported even further. But beyond that, what the world needs to get better at, again, is peacemaking and peace building, and crucially development. It's evident that it's much less common these days than it used to be in previous human history for there to be conflicts affecting the better off countries. So the path out of this little period we're in, unhappily globally at the moment, is very fundamentally related to development, and especially the achievement of the Sustainable Development Goals. In the meantime, the humanitarian agencies need to be supported to relieve the suffering of those people who, through no fault of their own, are caught up in crises and avoid them spreading further. Thank you.